Droopy and saggy, red and bumpy, dry and flaky, all things you don't want your skin to be. What if I told you you could avoid all of these, in some cases, just by managing your stress? Dermatologist Dr. Glynis Abalon is here to explain how internal stress affects our external appearance. So, stress face symptoms, you're saying they show up all the time.
And we know that stress affects what? Every organ of our body, and our biggest one is our skin. And I see patients all the time that come in with rashes and skin conditions, and guess what? When we find out what's going on in their lives, it's stress-induced.
And I guess most
frequently.
people think just acne as a stress response,
Right.
but you're going to give us a whole long list.
What's the first stress face symptom?
So let's just talk about something like rosacea. So you have a patient that comes in, they've got these acne, adult onset acne, and I know someone who's had some of that. Right.
Totally true.
And so the idea is that you can address just the acne itself or the rosacea itself, but if you don't address the causes, almost 80% of rosacea is triggered by stress.
The skin doesn't lie. It's like when we check a blood pressure doesn't lie. So if you ask me, do I feel stressed? I would say no. But if you look at the rosacea that popped up just in the last year, obviously the answer is 80% yes.
Right, and that's the idea, is that you really want to kind of go over the full picture. It's not just a, here's a topical cream or here's a pill.
Yep.
It's really finding out what else is going on.
Well, you have some solutions?
I have patients do prescription topicals. Sometimes I'll do oral medications, but I always talk about doing meditation, yoga, breathing techniques. There's so many things out there that really,
Take a chill
take
pill.
a deep breath.
Well, and it's not just things like rosacea. You actually have a personal experience with the next one.
I ended up writing this book called What's Stressing Your Face, based on the fact that my mother was sick with meningitis. She had bacterial meningitis, 11 days in the ICU, and we were told she wasn't going to make it. And she did. She survived it all, which was amazing. But then I didn't realize how the stress was affecting me. Taking care of my parents, taking care of my kids, running a practice, and I woke up paralyzed. I woke up one day, the side of my face was paralyzed.
So Bell's palsy.
I had Bell's palsy. The question, of course, is when you see that, you think, was it a stroke? You know, what was going on? So I had Bell's palsy, and I realized that I needed to change something. I needed to change my life. I had done some meditation, but I wasn't diligent. I had done some yoga, but I wasn't diligent. So really trying to change who I was and how I live my life, and getting back to a lower stress level. We're not going to eliminate all stress, but we get to pick and choose. And you get to say no sometimes to things that you otherwise would say yes to.
And the important takeaway here isn't that if you're stressed out, you're going to develop something like Bell's palsy, which is this paralysis of the facial nerve. But the point is that stress can exacerbate the condition, and it won't improve as well. Now, the last one, Dr. Abalon, is something that a lot of folks suffer from. Would never associate it with stress, though.
Right. Eczematous dermatitis. And eczematous dermatitis is a broad category. It does include things like atopic or contact dermatitis and different kinds of nummular eczema. There's kind of a broad category. But we see patients all the time come in the office with weird rashes. We don't know exactly what they are. You can get something around the mouth, around the eyes, scattered all over the face, scattered all over the body. And the question is, what's going on? And then you get into the history of it, and you find, okay, they actually do have perhaps biopsy-proven eczematous condition. And then what can you do? You can, yes, go on topical medication, but is that the only answer? And I think the answer to that is no. We really need to address what's going on in our lives and how to reduce that.
Like just hang out in the float tank.
I love float tanks. It's a great way to eliminate all the environmental stress.
Well, stress affects every organ, and your most visible one is your skin, so think about that. The good news is that Dr. Abalon mentioned her book, and everyone in the audience, you're all going home with a copy of her book. It's called What's Stressing Your Face? Dr. Abalon, thank you so much. Stick around.